So screening for colon cancer, there's two ways to go about doing it. There's the invasive way, which is the standard way of doing the screening, versus the non-invasive way, which is a little non-standard. The standard treatment or the standard screening tool for colon cancer is at the age of 50 years, you get your colonoscopy. And a colonoscopy is essentially a long camera that's inserted through the backside, goes all the way up and looks at the entire colon, assessing for any precancerous lesions, which are known as polyps, or any cancers at that time. At the age of 50, when you're supposed to get it, the likelihood of having a sporadic or a normal colon cancer is quite low, and that's why it's been instituted at the age of 50 to go ahead and do that. There are some other invasive types of screening tools which you can do. They aren't as complete as a colonoscopy. One is called a flexible sigmoidoscopy. And what that means is the first part of the lower half of the colon, as you're coming from the rectum back up, is called the sigmoid colon. And that's a higher incidence of having colon cancer than the rest of the colon. So we can do a sigmoidoscopy, taking a camera and looking at just that part of the colon to assess if there's any pre-malignant or any polyps that are there or any cancers that are there. That needs to be coupled with a fecal occult blood test where you test your stool for blood. And if you have blood in your stool, there's a higher risk of you having a colon cancer, and then you may need to get the full colonoscopy after that. In terms of the non-invasive tests, there are some newer tests that are coming to light that are being used more frequently. One of them is called a CT colonography, where it's actually a CT scan that's being used as opposed to the camera. The drawbacks on that, it's a pretty high dose of radiation to get that, but not only does it assess the colon, you can also assess other areas inside the abdominal cavity to see if there's any spread of disease if you do have a colon cancer. There's also what's known as a barium enema, which is essentially taking barium, which is a type of contrast material, through the backside, through the rectum as an enema, and then taking pictures of the whole colon and seeing if any defects are seen in the lining of the colon. So if there's a cancer there, you'll see a little bump actually on the barium enema in terms of using that as a screening tool. While it's not completely non-invasive, it's not having a camera placed up as well.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.